My name's Randy, and I'm a PGY6, soon to be PGY7 chief resident here at UNC. And I'm going into pediatric neurosurgery. I'm currently applying for fellowships right now. And I have a daughter who is almost 2 years old. So I'm super excited to talk about being a surgeon mom.
Hi, I'm Jackie MacDonell. I'm a current intern, soon to be PGY2. From Miami, Florida originally, did med school up in Albany, New York. I have two little ones. I have a 6-year-old and a 2-year-old. I had my son just before med school, and I had my daughter in my third year of med school.
Dr. Barnett and we got to chat a couple years ago when you were pregnant and going through residency while you were expecting. And so it's been a couple years since then, and now your daughter's almost 2. So I wanted to kind of follow up, from our last interview, Dr. Barnett, and talk a little bit more about, what it's been like being a mom and being this, far in your residency program. You're getting ready to be a chief resident next year. Can you tell me a little bit more about how the transition's been, some of the struggles and some of the highs that you've experienced so far?
Sure. I think having a child during residency was probably one of the most challenging things I've certainly ever done in my entire life. But it's also one of the most amazing things. I get so much enjoyment out of my job and so much enjoyment out of being with my child. And I can't describe how beautiful this experience has been, given no matter how challenging it's been. Every time I come home and I see her little face and she's so excited to see me at the door, it's just the best feeling in the whole world. I think we had some pretty challenging times after she was born. She was born pretty much during the middle of COVID, and that was prior to vaccines, and everyone was heavily socially distanced, and it was a pretty scary time. I think we didn't quite have the support that we thought we were going to have from family and friends. And my husband and I were pretty much on our own and with no childcare. So I think I was fortunate to be on my research year. We were very fortunate that he was working from home, and we were able to really tag team and be really great partners for each other. And I think that's one of the most important things that when I give advice to women who ask me about having kids, I think having a partner who's very invested and knows that they're going to be on this journey with you, and it's going to be tough. And sometimes it won't be 50-50. Most of the time, it probably won't be 50-50 during residency. They're going to be picking up a lot of the slack. But I think it really, even though it tested our marriage, I think we got a lot closer during that period of time. And now things, are better. Things are happier. People are vaccinated. We're having fun with our families now, and they're much more involved in our daughter's life now, thankfully. And being a mom has taught me a lot about perseverance and resilience, and certainly time management. And it's also made me a much better person. I feel like I'm a better doctor. I've always been really empathetic, but it's made me even more empathetic, especially toward parents. I understand more of the struggles now that is happening outside of what we see. And I think that is certainly going to make me a better pediatric neurosurgeon.
Dr. MacDonell, so you're getting ready to wrap up your first year, your intern year. Same question, the highs and lows of, trying to balance motherhood during your intern year and transitioning into residency.
Yeah, well, I think, coming into residency, having kids, especially having my son, he's 6 years old. So I've had 6 years of practice. That's how I like to say it, of like trying to figure out what to do before we came here. And so many times what we're told, like as women going into these types of fields is, you're never going to see your kids. You'll never see them. They're not going to know you. And I can say at the end of the year that that's not true at all. My children know me very well. They still come to me when they have their boo-boos. I still, I'm the one who still knows where their pajamas are. And, and I still feel like a very, active member of their lives and of my household. I think there's definitely ups and downs. I think coming into it, there's just such a huge learning curve, and you're getting used to this whole new volume of work that you haven't experienced yet. And when you come home, it's really hard sometimes to shake it off and to be there for your kids. And they're still young, so they're going to bed early. So you get this small window. And unfortunately, you've been on your feet all day. Maybe you've eaten, maybe you haven't. want so badly to come home, just eat something, take a shower, but you have these kids there waiting for you, and it can be hard to shake it off. I think in the beginning that was a huge challenge, but some things that we found have worked for us is kind of the same way that kids need schedules, like we kind of create like a routine and schedule for ourselves. So I go home, I take off my jacket, and we all say goodbye, work, and we wave goodbye. And I take off my scrub cap, and we're like goodbye. And then we actually have found that going outside and like watering the plants together. And for whatever reason, for me, once I'm outside and the phone is gone, and it's just me and the kids, and we're watering the plants, like I'm truly present with them. And that took a lot of time though, and a lot of troubleshooting, because for a while I would come home and would miss those windows with them where I'm still thinking about work, and I'm like, oh, did I do that? And I'm getting on the computer and I'm looking up stuff for my patients, and then they're asleep and you're like, oh man, what did I do to myself? I just completely missed this. And that's a struggle that I think all women go through, who are working, who have careers, and you don't get it right every time, and it takes practice, and but hopefully with time you find a nice rhythm for yourself and your family.
Did you connect with Dr. Barnett before you interviewed at UNC?
Yeah, I absolutely connected with Dr. Barnett before. I think having kids beforehand, it was a huge decision. And there were so many times where I felt like, am I sacrificing my kids for this dream I have? These weren't theoretical people that weren't here. They were here, they were in my life, and it was something I agonized over tremendously throughout the 4 years. And so I was like, thinking, I'm like, there's got to be other people doing this. Like, there has to be, like, let me see what, like, and I just went on Twitter, and I was just like, looked at hashtag moms in neurosurgery. And then I found Dr. Barnett, and I stalked her so hard. And I like followed her entire life. And I'm like, and whenever I would feel just not like, there would be a voice of someone saying, oh, you're not going to see your kids, or, oh, don't do, I would go back and I would be, look at this person. I'm like, look, she's happy. She's doing it. And then even my husband caught on, and he's just like, you're neurosurgery girl. That's what we called you. You were like, you're nurse, but look at your neurosurgery girl. And whenever I had any doubts, like I went back to that, and it doesn't take a lot. You just have to see other people doing it, and, living their lives and being happy. And then eventually I mustered up like the courage to message her. It was a whole ordeal. She doesn't even know this. My husband had to proofread it. I got like nervous when she responded and made him read it to me. And so, yeah, we connected. She was definitely a huge driving force for me coming to UNC, and we definitely connected before.
Have you been able to connect with other women in medicine over social media that are interested in neurosurgery, or that are currently in and kind of looking for community?
Back before I was applying to neurosurgery, when I was still in medical school, I really looked to social media to find mentors. And this was like when I was applying for my sub-internships, I was like trying to find programs where there were other women. And at that time, there were very few women in residency in neurosurgery. And one of the programs that I had come upon was LSU New Orleans, and one of their residents that was there, Lindsay Lassane, has become a phenomenal mentor for me. And I actually applied for that rotation just so that I could meet her and have her as a mentor, because there were so few women in neurosurgery, and I thought she was phenomenal, and she was, and she still is. She's now practicing down in Louisiana, and she's a mom of 2. And I've gone to her for advice over the years, and it's just been such a great experience. And I've really tried to carry that on and be that mentor for other women in neurosurgery, or even women entering other specialties in surgery, because I do feel like we really need that community to feel like we belong here and that we're supported here. And I think it's so important for women to be supporting other women.
When you're approached by other women who are interested in entering neurosurgery, what advice do you give them, or what advice would you give to any woman who's interested in neurosurgery but is hesitant because of, concerns about having a family and being able to balance that?
Yeah, I think, some of the things that I like to talk about, it's important to take everyone's, advice under consideration, but not everyone's advice should have the same weight. There are so many times where I would panic. Someone would tell me, your kids aren't going to see you, they're not going to know you. And And I would talk to my husband. He's like, well, who said that? Like, what do they do? Are they even in medicine? Like, why are we listening to them? And I'm like, oh yeah, you're kind of right. And so I think it's so important to go and find people who are like you, who are doing what you want to do. For me, that was Dr. Politzis. It was Dr. Paul. They're two female neurosurgeons, both moms. And their advice had more weight than other people. And, unfortunately, you get advice from everyone, whether you want it or not. And a lot of times when you're looking at this type of competitive specialty, a lot of it is usually negative in terms of work-life balance. But making sure that you find those right people, and that you take their advice under more consideration than other people's.
Prior to residency, people saying, oh, don't you know how hard neurosurgery is? Or don't you know that you'll never be able to, be with your family, your kids will never see you, just like she said.
Yeah.
And that's not true. I don't quite know where this came about, but it's not true at all. And I think it's something that has really dissuaded women for a very long time from pursuing these specialties. And, I just want you to know that there's a place for you here. And it may not be at every institution here in the US. You may have to seek out places that are, I think, more progressive and want to be supportive of women. And I think that there's a trend that is that's coming up, and I think people are realizing, that some of the damages that has been done in the past that has persuaded women to do other specialties because of those hurtful things that were said before. But I just want women to know that there is a place for them here. You can be a surgeon, you can be a mom, you can be successful at both. There is no perfect balance. I think once I figured that out, that there's no balance. Some days you're going to be with your child all day, and some days you're not going to see them. But I think what matters is you have to pick and choose what experiences are meaningful to you and what experiences are meaningful to your child. And you have to be completely present wherever you are. So if you're at work, you need to be completely present at work and be there for your patients and do the best job you can to be the best surgeon that you can be. And when you're at home, likewise, you need to be the best mom you can be. You need to be there for your child. You need to enjoy all those little moments, all the little cuddles, and tell them you love them so much. And mommy's always there for you, even if she's not physically there, she's always there. I think that's just something to keep in mind is, a lot of us, we're all experiencing the same thing. We all talk about our struggles. And I think, that's super important to know. None of us are perfect and will never be perfect. And you just have to try. That's all you have to do is try and, be happy and grateful for, all of these experiences that you're having.
What are some changes do you guys think need to be made to all neurosurgery or surgical residency programs to allow for more women to feel comfortable and have a more optimal work environment?
There's a lot of talk about this right now in the neurosurgery community. I think there's a lot of focus on what we can do to attract more women to our specialty and our programs. And a lot of the discussion centers around childbearing and parental leave. And I think it's a very important topic because it not only affects women, it also affects our male colleagues. I think, our male colleagues also haven't had the experiences that they want to have with their children. And I think, these discussions are going to benefit everyone in the long run. But I think one of the most important things that we have to address is this issue of not having a standardized policy that's supported by the American Board of Neurological Surgery. I think that in order to really push for more gender equity in neurosurgery, I think we're really going to have to focus on that and really come up with a good standardized plan for residents across all programs at all institutions here in the U.S. Because regardless of the way that you give birth, it's very tough. I didn't realize how tough it was going to be until I went through. I thought I'd bounce back in a week or two, and that was certainly not true. And also, time for bonding with your baby, time needed to establish breastfeeding practices. Because, American Academy of Pediatrics recommends at least 6 months of exclusive breast milk and then a year of breast milk, in addition to that. And so if we want to try to follow guidelines as physicians and we want to support that, I think you have to support giving an ample amount of time to be able to have that experience. Because I certainly think, it's tough for both women and men. Obviously, women have different struggles after, the birth of a child, but even talking, with, male colleagues across this country, I don't think that they've gotten the time that they need either. I think it definitely takes two parents to raise an infant. It's extremely difficult, as we all know on this call. All of us are parents. And I think they deserve the same amount of time that we do as women. And so I think that's one of the most important things that we have to address is really just having a standardized amount of time. And, if you have a child during residency, this is the amount of time that you get allotted for paid time off. And this is the amount of time that we can support you on parental leave. I think it would be better received that way because I think all of us are type A and we don't like asking for time off. It's, it's just not in our nature. So I think if it was offered, people would certainly take it. I also think that we have to be cognizant of anyone who breastfeeds their child. That is a very important thing. And in order to keep that up, while you're at work away from your baby, you have to resort to pumping. And I think a lot of people may not feel empowered, or they may feel embarrassed to talk about this issue, especially in a male-dominated specialty. I think I was lucky because I had a lot of support from my department and I felt comfortable enough to talk to everybody about this. And everyone knew that there was going to be times where I'd have to step away to go put my pump on. And I actually had a portable pump that I would use to pump during surgery. I'd pump on rounds, and it was no one knew unless they, every now and then you could hear a little whirring sound. Everybody was like, oh, is that someone's pager going off? Is someone's pager on vibrate or something? But they all knew that I would have to at some point step away, to go clean my pump, put away the milk in a refrigerator or something like that. And I think, having policies in place that support residents and attendings and being able to do that, I think is going to be really important.